So let's put machine learning within the context of epidemiology. If we divide the skills into three groups, hacking skills that allow us to automate processes, domain expertise that give us the intuition to postulate hypotheses, and multivariate statistics that allow us to validate, for example, these hypotheses, then machine learning will fall within the interaction of hacking skills and multivariate statistics. The automation comes from the fact that machine learning is entirely data-driven, and the validity comes from the assumption that the data that is being used to train the model precisely and accurately measures the phenomenon that we're trying to model. And therefore, the assumption is that the model is valid, although I will argue that that still remains to be proven. And then the interaction between domain expertise and multivariate statistics is what we know as the traditional research, which within the field of mental health research is what we call epidemiology. And the question is, how do we bring these two together? Or rather, how do we bring machine learning within epidemiology? So I think it's fair to say that machine learning didn't have a good start within clinical research in general. It has let down the medical community and the public in many occasions, and it keeps doing so. There is plenty of articles published that are clinically irrelevant, and they are still being published today. There is research that follows flawed methodologies, again, within the context of epidemiology. And there has been cases of non-transparent sharing of data with industry, which of course doesn't help with trust. This is not to say that all is negative. Success stories do exist, but unfortunately, they represent a very small minority at the moment. And I think that on hindsight, this shouldn't be surprising, because the paradigms of epidemiology and machine learning cannot be more different. In epidemiology, we rely on statistics and hypothesis testing. We very closely follow a strict ethical etiquette for good reasons, and our efforts aim at ensuring that we obtain robust and biased results to produce strong evidence and knowledge. So the aim of epidemiology is to understand the true mechanisms connecting exposures and outcomes, with an emphasis on true. So in order to do so, it naturally gravitates towards simpler, easier to interpret models. It's not that they are the only models that are used, but they are the most commonly used, and they are the ones that we want to use the most because it will help us to achieve our goal of understanding the true mechanisms connecting exposure and outcome. Machine learning, on the other hand, it has its own methodology, which is fundamentally different. It's geared towards solving problems and developing applications that solve those problems. It pursues maximum success at solving these problems, at achieving a goal, which is often identification or prediction. So it naturally gravitates towards using complex algorithms that are often more powerful. Now, to exemplify this difference, we can talk about logistic regression. Logistic regression is a technique that is used by both epidemiology and machine learning. But the way they use logistic regression is fundamentally different. In epidemiology, when we use logistic regression, we focus our attention on the values of the coefficients, because those values tell us the relationship between the independent variables and the outcome. And everything we do goes towards ensuring that those values are correct. So if we have a correlation, we have correlated independent variables, we take care of that, because we know that correlated independent variables will affect the values of our coefficients, and therefore it will contaminate our results, and it could lead us to the wrong conclusions. Machine learning, on the other hand, doesn't care about that. It doesn't care about the values of the coefficients. All it cares about is the accuracy of the classification task at hand. In fact, adding another variable that may be correlated, that is correlated with other variables, can increase my accuracy, even though it will affect the values, or even though it will affect the values of my coefficients, it will increase my classification accuracy, and therefore I'm happy to include that variable. So that is, I think, a clear example of an example that clearly illustrates the difference between epidemiology and machine learning. So then, why do we then care? Why do we try to bring machine learning within the field of mental health epidemiology? And the answer is that, mental health is influenced by a wide range and a great number of factors. So these factors are not only clinical, they are also social, demographic, economic, educational, etc., etc., etc. And they interact in very complex ways. Classical statistics is not geared towards handle this scenario. Also, classical statistics reliance on prior expert knowledge and model assumptions, it's another important limiting factor. And these two limiting factors are typified in suicide research, where a meta-analysis found that in 50 years, we have barely made any progress. So we now have more data, and we can actually link all these data together. So that is good. But this has also brought additional challenges. So now we have increased volumes of data, and the data suffers from quality issues, missingness, and also the data is not collected for research. So the variables that we want to use may not be directly measured. Therefore, we need to somehow extract them from the data. And the way we extract these variables is not standardized at the moment. And on top of that, the field of mental health is evolving. And there is a lack of expert consensus on the taxonomy of psychiatric diagnosis or on preferred transdiagnostic clinical phenotypes. And that doesn't help us either. However, this is the type of problem that machine learning excels in, because as we said, it's data-driven, so we don't have to fully rely on domain expertise, although it's necessary. It can handle large volumes of data with many different variables, and it can handle very complex interactions between these variables. And that is why we want to bring machine learning in the field of mental health epidemiology, because the hypothesis is that it will help us make not a step forward, but a leap forward in our understanding of mental health disease. So I want you to think back. Think back to your research and think of cases where you believe now that machine learning could have been of use. And why do you think that is? And how do you think machine learning will have helped you? The scientific community is expectant to see what machine learning can do. What can it achieve? And the number of research published on mental health using machine learning has increased rapidly in the last 5 years. As we said earlier, not all that research has the same quality. But, I will say there are three things that we need to keep in mind when we try to use machine learning in mental health research. First, we need to keep sight of our mental health related aims and objectives. So, why is it that we're doing this research? Because it's easy to get distracted with the fact that we're using machine learning and get excited and then lose ourselves into, the important thing here is actually the fact that I'm using machine learning. But I will argue, no, that the important thing here is what is it that you can get, from using machine learning from the point of view of mental health. So, what? So how can I put this? So, we're doing research because we want to find out maybe what are the risk factors affecting a mental health outcome and how these risk factors interact and what are the protective factors and what are the best treatments for different conditions or for different patients, and potentially try to predict what will be the outcome of a given treatment for a given patient. That is the aim. The fact that we use machine learning is just circumstantial. We use it because we think it's the best tool for the task, but it's not really the most important characteristic of our work, of our research, Now, what we find in our analysis, that is what is important. That is what is clinically relevant. So we need to keep sight of that. Also, we need to remember that the same hurdles that apply on epidemiology remains when we bring in machine learning. So let me rephrase that. We need to remember that we're bringing machine learning within the field of mental health epidemiology, and therefore the rules of epidemiology still apply. There are still issues that we need to deal with, for example, underlying biases on the data and how we handle those biases, or heightened privacy requirements and how we deal with those privacy requirements so that we keep the trust of the public and the patients. So everything we did on epidemiological research in our methodology, we still need to do for our machine learning when we bring machine learning in. Plus something extra, and that's point 3. Using machine learning in mental health epidemiology is not free of cost. it adds an enormous level of complexity when we're talking about building and validating models. And even more so when we are talking about approving machine learning enabled clinical devices. So only use machine learning if you need to use machine learning. Again, don't get blinded or don't get pulled by the hype of machine learning. Just be critical with the fact of be critical with whether you need to use machine learning or not, and be critical with the findings and the results that you get with machine learning. That would be my advice. This is something that we have explored and expanded on this opinion piece. So you're very welcome to have a look at it. And also, this is another paper, another opinion piece that was published by Jan Speechley and Michael McTernan, which are both members, PPI members of DATAMIND. And I think you should definitely check this one out as well. This is a really interesting, really easy, and really fun to read piece of work. So yes, do check it out.